is my PCS presentation. The first case I chose was 25-year-old man was a passenger in a motor vehicle accident involving a collision. Ended up getting fractures in two adjacent carpal tunnel bones. And he was then diagnosed with post-traumatic arthritis in his right hand. To correct this condition, he underwent a carpal tunnel fusion of the right hand with bone graft, and this was done using an open approach. So our first character, obviously, is going to be medical surgical. So it's going to be 0. Our next character, since it is his right hand, we're going to do R, which is upper joints. Our third character, our root operation, is going to be fusion, which is G, because it says intercarpal fusion of the right hand. And for body part, it is going to be, we're going to look for the carpal joint, because that's what that's what the hand is. It's joints. Your fingers are joints. So carpal joint, we're going to find carpal joint, and this was his right hand, so it's going to be Q, and it was an open approach. And then for device, so see, looks like bone bank bone graft, and so that's going to be autologous tissue substitutes, number 7, and then there are no qualifiers. So the code for this is going to be 0RGQ07Z. Okay, moving on to number 2. 55-year-old man diagnosed with prostate cancer, for which he underwent an open radical retropubic prostatectomy. And again, the first character is going to be medical surgical. The body system, the prostate is part of the male reproductive system, so that's going to be V. He had a prostatectomy, so that's where you remove a whole body part. You take it out, you remove it. So it's going to be T, resection, cutting out or off without replacement, because we are not replacing the prostate. So that's T. And then obviously, what are we cutting out? The prostate, so that's going to be 0. It's going to be an open approach, because it says it right here, open. And there are no devices and no qualifiers. So this is going to be 0VT00Z as in zebra, Z as in zebra. All right, moving on to number 3. All right. Resident from an assisted living home complained of incomplete bladder emptying, immediately taken into surgery, where they performed a transurethral endoscopic laser ablation of the prostate. So it's going to be, again, it's going to be 0, medical surgical. All right. And then we're going to do, it's going to be V again, because again, the prostate is part of the male reproductive system. And for the root operation, ablation basically means to destroy or destruct something, basically like burn it. So it's going to be number 5, which is destruction. And again, we're doing this to the prostate, so it's going to be 0. And for the approach, it's going to be via natural or artificial opening, endoscopic, because the urethra is a natural opening, but it's going to be endoscopic because it says endoscopic laser ablation transurethral. So basically that means they are putting a scope up the patient's urethra to help do this procedure. And there are no devices, and there are also no qualifiers. So the code for number 3 is going to be 0, V as in Victor, 5, 0, 8, Z, Z. All right, on to number 4. All right. A 65-year-old male patient was diagnosed with mitral valve prolapse, specified as rheumatic. He has a history of rheumatic heart disease as a child. He underwent a mitral valve replacement using porcine, not sure if I'm pronouncing that correctly, tissue, and they did this via an open approach. So the first section is going to be the medical surgical, and for body system, it's going to be the heart and great vessels. It's number 2. And for the root operation, going to be R, replacement, because it says it right there in the documentation, mitral valve replacement. And for a body part, we're going to go down until we find mitral valve, which is G. Approach, open approach, says it right there in the documentation. And for device, it is going to be number 8, zooplastic tissue. Basically, what zooplastic tissue is, it's tissue from another animal. And I believe when I researched it, this porcine, however you pronounce that tissue, is basically tissue from a pig. So it's going to be number 8, the zooplastic tissue, and there are no qualifiers. So the The PCS code for number 4 is going to be 0, 2, R as in race car, G as in girl, 0, 8, Z as in zebra. Okay, on to number 5. Number 5 reads, the patient is suffering from chronic kidney failure secondary to hypertension and receives renal dialysis treatments 3 times per week on an outpatient basis. Today he comes in for his regular renal dialysis treatment. So this one's going to be a little different than our first 4. So for dialysis, the section that you do dialysis is this extracorporeal or systematic assistance and performance. Because when you think about it, what is dialysis? Dialysis is basically helping your kidneys work via an outside machine. So body systems, there's only one choice, physiological systems, and that's A. And again, since dialysis basically makes your kidneys work when they wouldn't work normally, it would for operation, it's going to be number 1, performance. Body system is obviously urinary, because the kidneys are part of the urinary tract system. And for duration, he receives dialysis treatments 3 times per week on an outpatient basis. And typically, when patients do dialysis outpatient, it's only for, say, 1 to 3, maybe 4 hours a day, several days a week. So it's going to be 7 intermittent, less than 6 hours per day. And function is filtration, because essentially what dialysis is it is when you manually have to make your kidneys filter out all the toxins artificially. And there are no qualifiers, so the last character is going to be Z. So the PCS code for number 5 is going to be 5, A as in apple, 1, D as in David, 7, 0, Z as in zebra. Okay, going on to number 6. So number 6, the patient who is an avid skier slammed into a tree and sustained a fracture of the shaft of his left fibula. His physician ordered traction to ease the pain while waiting for surgery. And then his physician also noted that surgery could be avoided by the application of mechanical traction with a in which a traction apparatus is applied. So again, this first character is going to be different than the first 4, which were medical surgical. And since it says in which a traction apparatus is applied, surgery might possibly be avoided by the application of mechanical traction. So for application, it's going to be number 2 right here, which is placement. And then for our second character, for body systems, we're going to choose anatomical regions, which is W. because Y for orifices, that only applies to like the mouth, the anus, and other bodily orifices. So we're going to choose W. All right. For our root operation, it's going to be number 6, which is going to be traction. And for our body region, we are going to scroll down until we find until we find the upper, or I'm sorry, the lower leg, because the fibula is the lower part of your leg, and it was his left leg, so that's going to be R, lower leg left, and obviously the approach is external, because you apply traction outside of the body, not internally. And for device, it says in which a traction apparatus is applied. So that's going to be 0, traction apparatus, and there is no qualifier. So the code for number 6 is 2W6, R is in race car, X is in X-ray, 0, Z is in zebra. All right, moving on to number 7. All right, a 1-day-old, 2,200-gram female infant, born prematurely. Um, um, the diaphragmatic hernia was repaired via an abdominal approach, and the hernia sac was excised. All right. So for this one, we are going to go back to 0, medical surgical. All right. And for the body system, it's going to be D. Oh, I'm sorry. It's going to be anatomical regions, general, which is W. And for our root operation, it's going to be the letter Q, which is repair. All right, and then for the body part, it's going to be F, which is abdominal wall, because that's where a diaphragmatic hernia is in your abdomen. Basically, what a diaphragmatic hernia is it's a hernia, and since it is in your abdomen, basically it pushes, because it is in your abdominal wall, what it does is it pushes all of your abdominal organs up into your chest cavity, essentially making it difficult to breathe. So our 4th character for this code is going to be F, abdominal wall. And our approach is going to be 0, open. and there are no devices and no qualifiers. So our code for number 7 is 0, W, Q, F as in Frank, 0, Z as in zebra, Z as in zebra. All right, on to number 8. All right, a 10-year-old boy sustained a severe injury to his little finger when he was getting out of the car. Someone inadvertently slammed the door on him. Due to the severity of the injury, the finger on his left hand could not be saved. He underwent a 5th ray carpometacarpal joint amputation on his left hand via an open approach. All right, so for number 8, our section is again going to be medical surgical. 0. For our body system, it was one of his fingers. So we're going to scroll down until we find anatomical regions, upper extremities, because that's what your hands and fingers are considered upper extremities. So that's going to be X. For our root operation, looks like they had to amputate his finger. So that's going to be 6, detachment. All right, and for the body part, we are going to looks like it was his little finger on his left hand. So we're gonna scroll down until we find little finger left, and that's gonna be W. It was an open approach. There were no devices. And looks like it was a complete amputation. So it's going to be 0. All right, so the code for number 8 is going to be 0, X, 6, W, 0, Z, 0. All right, we're going to move on to number 9. All right, number 9 says a patient with a 20-year history of severe complicated ulcerative colitis was admitted for surgical intervention. A total abdominal colectomy with ileostomy was performed via open approach. So our section is going to be medical surgical once again. Our body system is going to be D, the GI system or gastrointestinal system. Our operation is going to be excision, which is where you remove a body part. And what a colectomy is basically when they totally remove your large intestine. And and they had to, and since they removed the large intestine, that's why they had to create the ileostomy. So this patient's waist would have a form of escape, or a way of, um, coming out of the patient's so it's going to be E, large intestine, um, and it said it was done via an open approach. All right. And then for qualifier, the documentation did not say that it was for diagnostic purposes. So it's going to be Z, no qualifier. So the code for number 9 is going to be 0, D as in David, B as in boy, E as in elephant, 0, Z as in zebra, Z as in zebra. All right. Last one, number 10. Um, a 20-year-old female underwent a low cervical cesarean section to deliver her twins. So for this one, the section is going to be number 1, obstetrics. And in the obstetrics section, the body system is always going to be pregnancy, which is going to be 0. And for the operation, on this case, it's going to be D, extraction, because essentially that's what a cesarean section is it is a alternative way to deliver the baby when the baby cannot be delivered vaginally. And so for the body part, it is going to be 0, this products of conception, because I guess in 3M that's what they how they word a fetus. And so for the approach, it's going to be open, because with a C-section you are basically cutting the mom, making an incision into her abdomen to get to the baby to deliver. There are no devices, and for the qualifier, it is going to be this number 1 right here, the low, because in the documentation it says underwent a low cervical cesarean section. So the code for number 10 is going to be 1, 0, D, 0, 0, Z as in zebra, 1.